Welcome to the Heart of Innovation. 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Abbott. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hi, everyone, and welcome. Today, we're diving into a critical health issue that is more prevalent and deadlier than most cancers combined. It's called Peripheral Artery Disease, or P.A.D. And if you've tuned in a lot, you hear this a lot. P.A.D. is a leg circulation problem that affects millions, yet remains underdiagnosed and undertreated. Now, we'll be exploring the vital importance of advanced education for both doctors and patients in combating P.A.D. during the Heart of Innovation today. We'll be discussing two recent groundbreaking conferences, one that equipped physicians with cutting-edge tools and techniques, and another by the Global P.A.D. Association that empowered patients to become informed advocates. So join us as we discuss how knowledge is power in the fight against P.A.D. and how patients are raising their voices to create the change that they want to see. So hi, everyone, again, welcome. Let's get into it. Let's say hello to my co-host, amazing co-host, Dr. John Phillips, who was with me at both of these events over in Chicago.
Hey, happy Saturday.
Happy Saturday.
I'll just say that having come off of two back-to-back conferences dedicated to limb-threatening ischemia or lack of blood flow, and then on the heels of that, doing the patient advocacy type conference, I would say it's kind of like the first Save My Piggies that I've seen with a bunch of patients and been a part of, which is kind of cool. I liked all three, but my favorite was the latter, interacting with patients, hearing their stories, and the emotions that were present were pretty intense. I mean, I honestly felt like I was at an AA meeting or something where people are just kind of like telling their soul, or just exposing themselves very rawly to what happened with them and their fight for their limbs and their vascular issues. So very, very powerful couple weeks for me. So it's been cool to be a part of.
Yeah, it was a lot, and it was really nice to see so many passionate doctors such as yourself show up for the Save My Piggies conference in Chicago. We had more than 24 patients and their family members and friends show up to share their stories, to learn from one another, and to most importantly raise their voices. And we had we had Dr. Parag Doshi and Dr. El Sayed Mohammed from Chicago. We had Dr. Zola Ndandu, who's an interventional cardiologist who came in from Florida. And we had, who else was there? Gosh, we had so many there that.
Well, Dean, the chairman was there. Dean was there. Shared some stories and.
Yeah, we shared some of our nightmares.
You can't plug me, guys.
There he is.
Here he is. He comes out of nowhere.
I think that's the first time I've ever heard him on air. So, hey, Dean.
I think so.
I think it's cool because you and you do a wonderful job of getting us guests and really kind of coordinating a show. And oftentimes we do go on tangents, but we have kind of a circular theme for each show. Once in a while we'll just kind of do an ad lib show, which is what this is going to be today. So I'm kind of excited. Hopefully our listeners will enjoy it. But I'll just say this because I saw a patient, and if you don't mind if I share this, I saw a patient this week who was diagnosed with peripheral arterial disease for the first time. And I kind of asked her, I said, have you heard of peripheral arterial disease? Do you even know what that is? And she's like, no. She just says, I know that my leg hurts when I walk. And I kind of went into, I normally don't go into hey, I'm trying to scare you, but I really have lately been focusing on modifying patients' risk factors, which tobacco cessation is one of them. And so I kind of went into the whole hey, this diagnosis, we can help you and we can maybe through procedure or surgery or whatever get you feeling better, but you've got to really kind of own this yourself. And I told her what you had said earlier about, hey, this diagnosis is often worse than some cancers. And that, like, she kind of like gasped. And I said, again, I'm not trying to scare you. And her son was there with me. And her son looked like he worked out, and the patient looked like she had was a smoke, like that look about him. And he kind of got it too. And I think they walked out of there a little bit more educated. But before we went on, you were saying that you guys have a way of preparing patients for an office visit with someone such as myself, which I think is very helpful, because it took me a while to get through her. I mean, it takes us all a while to get through their records, but sometimes we don't hear the full story. And so can you share with us like what you do there? Because I think that's really important for patients that are listening and might need to be seen.
I think the most important part about what we do when we start a preparation session, we do appointment preparation for anyone who's interested. It's a 1 hour preparation session, which is much more than a 15-minute consult that they have with their physician, or even 30, and sometimes an initial consult. And as I said, the most important part is giving the patient the opportunity to just vent, to share their hearts, to share everything on their mind, because that's where I can actually, and this is what I did as a journalist, was before I really asked the questions, I just wanted to hear what was in the heart and the mind of the guests that I was interviewing, or my subject that I was interviewing. And that's where you're learning their style of speaking. You're learning a little bit more about what's important to them, so that you can use it later on in the discussion to help guide them through the process of preparing for that appointment. We, of course, get all the medications down. We talk about the supplements they're taking, but not just the supplements they're taking, but why they're taking them. We talk about their activity, and we talk about what might be hindering their activity. So we're asking questions in a way that, what is their life like? What makes them happy? What is limiting them from doing what they want to do? And so it's a different series of questions than what you would be asking, which is, let's look at your blood pressure. Let's look at things just clinically. And so we use all of this information to then put it into a one sheet that we send to the doctor as well as the patient. We talk about their purpose. What is their purpose in life? Why do they want to walk? What does it mean to them to have a better quality of life? And then what motivates them? Because wouldn't it be helpful, before you even started talking to the patient, to know what motivates this patient, so you know how to address them, how to rephrase things. You as a doctor, I would imagine, are constantly trying to phrase and then rephrase and then rephrase and then recalibrate and rephrase, depending on how that conversation is going and depending on the questions that the patients are asking, right? And so then we go into just the critical questions, the basics to ask the doctor. And we have a lot of our own questions that we explain to them, the intricacies of the different treatment options, so that they can better have a more productive conversation with the doctor. So it's pretty extensive. It's really powerful. And for Alan, whom you'll hear from later on in the show, about his experience with a life-saving doctor, how our preparation really helped him to expedite his life-saving care. Coming up right here on The Heart of Innovation, we are going to have to hear some inspirational words from Dr. Phillips. We're going to have to get that moment of inspiration that everyone looks forward to every week. So stay right here on The Heart of Innovation on KDOW. Don't go away.
3 years ago, my symptoms started with leg pain and leg cramps while walking.
Me too, with a tightness in my calves.
Well, do you know, my doctor thought that my leg cramps were a side effect of the statin he prescribed me.
Well, my doctor just brushed them off as another symptom of old age.
Mine thought the pain was radiating from my spine.
My doctor blamed my neuropathy on diabetes until I got a wound on my foot that just wouldn't heal.
Yeah, it turns out we all have peripheral artery disease, also known as P.A.D.
It's plaque buildup mainly in the leg arteries, causing poor circulation.
For me, the diagnosis came too late and I lost my leg. But that does not have to happen to you.
No, it does not, because there are treatment options available if you're diagnosed early enough.
P.A.D. Peripheral Artery Disease. If you are experiencing leg pain or leg cramps when walking, call the Way to My Heart's Leg Saver hotline now.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips, spectacular vascular moment of inspiration.
I'm sorry. Every time I hear the little horn, I think like of Shrek, the movie Shrek, when they're like making their way into the castle. Like, I'm sorry. I just love it. And
Hilarious.
I'm just a 15-year-old and a 40-something-year-old.
It'll never change. It's
No.
actually one of my favorite parts of the show.
So speaking of change, this quote is about change. There's been a lot of change in the Phillips family this week. We moved my middle daughter away to college, so that was you got to let the bird leave the nest, and certainly she'll fly, but it's not easy. And as I was telling you, Kim, my family is moving from Wisconsin to the Columbus area. A lot of my family, actually most of it, that happened late last night, and we're still kind of getting people settled in. So there's a lot of change going on. And there's always change, right? And so I wanted to find a couple of quotes on change, and I found two that I like, so I'll share. The first one, this is from the poet Maya Angelou, and she says, "If you don't like something, change it. If you can't change it, change your attitude," which I thought was kind of interesting. And then finally, this one, I think a lot of people have heard from Gandhi, but I think it's about looking from within to make change, as opposed to it's the inside out as opposed to the outside in. But you must be the change you wish to see in the world. You must be the change you wish to see in the world. So two nice quotes about change. I like the one about changing your attitude, right? I mean, because a lot of times we have attitudes that probably need to be adjusted a little bit when the change that we want isn't we're not seeing how the fruits of that labor. So change the attitude. So anyway, change. It's inevitable.
I love that because we always tell our patients that we work with, you've got to create the change that you want to see. And it's so interesting that you picked those quotes, because Dr. Romy Chopra with Mimit Health, he was backed by popular demand at this year's Save My Piggies conference, because the previous conference 2 years ago, we had him talking about the new Arion laser and its use in roto-rooting the arteries. And one of the patient's wives, Tony, asked him a question about, that's great, you have all of these technologies, you have all these tools, techniques, but let's just focus on the patient. How do you help the patient, not only physically, but mentally deal with this chronic illness? And he went into this literally 15-20 minute full spirit of medicine dissertation. And so everyone was saying, hey, we want him back. We want to give him the floor and have him do a keynote on the spirit of medicine. And so he did. And I'd love for you to hear it. I don't think you did. So Colin, our producer, would you mind queuing up Dr. Romy Chopra on how the patients need to take responsibility for their health?
If you had $1 million horse, we just let it sit around all day, do nothing. The horse says, I don't feel like walking today. It's $1 million horse. Get up, move. Your body is your spirit's horse. Your mind is the reins for the chariot. Your spirit is running that chariot. Within your paradigm, you can do is your best. So some days it's getting out of bed or walking to the bathroom. Someday you're maybe running a marathon. Fair enough? So in that paradigm, now, if you have a car, you have a problem with your tire, it affects your whole system. Now, if you go to Midas, what are you going to get? A muffler. So part of the problem is raising awareness. And this is what I really, really want you to get a grasp on. You must chase health, wellness, and not a diagnosis. Okay? Now, if you have a house, it's a 100-year-old house. What do you think is happening to the pipes? They're rusting. They're the laws of nature. Hair turns gray, you'll do something. But you will check out one day. Life's a one-way street. There's an exit waiting for you, but your responsibility is to do the best you can to live to the max of your potential. So when we were talking about get up and walk for P.A.D, blah, 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 That is you living to your potential. We're not telling you, I don't tell my patients, you've got to walk. Now, smoking. Why do people smoke? You smoke for a while? Why did you smoke? It made you feel better. Now the question is, it was unnatural and it had other side effects. So therefore, you see what you said, you needed endorphins. So what's a better way to get endorphins in your brain? Move, workout. That's one way to look at it. When I say holistic, it is not about some hokey pokey, some mantra, some stuff. It is about encompassing everything that is available to you as a human being. All the resources for what purpose? So you can lead your best life. Fair enough? So within that paradigm, there are so many things you can do. The first is, okay, you won't put kerosene in your car, but how many of you eat burgers and fast food and all that stuff that's not good for you? Not anymore, but let's see. You start with that. Yoga every day. Don't put kerosene in me. Sleep. No, they're aids. Do I enjoy some alcohol? Absolutely. Do I enjoy good food? Yes. Excess is a problem. We live in a place of abundance. You have to ask yourself, why did I get P.A.D in the first place? Take responsibility. There are a lot of people to help you. God bless this woman. She's a powerhouse of energy. But remember, you can delegate the blame, but not the responsibility. Next time I see you, each one of you have lost 20 pounds. You can take some aids, take some metformin, get some Ozempic. You're responsible. We'll open the pipes for you. Yeah, I tell them human plumber. I joke about that all the time. Ask me what kind of doctor is a good one. That's another joke. Sure. So I'll leave you with that. All of you know where to find me.
I'll just expand on that a little bit because I think it's an interesting topic. Trying to, have patients really be the quarterback of their healthcare. I saw a very nice 97-year-old woman yesterday, and she's accompanied by her daughter, who's, gosh, probably in her late 70s, I would imagine. And it was an interesting, they lived together. And the mom, who's 97, met her for the first time, but very, very functional. I don't think she drives, but really has her wits about her. And she had an aneurysm that we had fixed. And sometimes aneurysms get we call them endo leaks, but there's blood flow that kind of is getting into the aneurysm sac that can cause the aneurysm to grow. That's the biggest thing we worry about, is the aneurysm rupturing. And the patient tells me, she said, I was at 2 different doctors and everyone said they couldn't do anything to help this. And long and short of it was, well, none of the doctors, and I don't blame them, she's 97. They didn't really want to touch her. And so we went into this kind of long conversation about what your goals are, like, how's your quality of life? And at the end, because I tell patients, when an aneurysm ruptures, unfortunately or fortunately, it's very quick. And patients expire quite rapidly. And
yep,
she looked at
my mom.
Right, exactly. And she looked at me and she's like, man, I'm 97. That's not too bad. And I said, it's actually pretty quick. And I didn't think I'd be getting into a conversation about modes of death. And that's really not what we talked about. But that was one visit where I spent more time than normal just kind of talking with the patient and trying to understand what her wishes were. Because I said, listen, I can do a procedure and we can try to fix this if you want. And we really kind of, to your point earlier, went into like the why of the visit and what's your quality of life and what do you want out of this visit. And I think that's what we miss sometimes. Like, you come and see me and it can be, patients can feel like it's a Ford assembly line, like patient 1 in, out, good, next. And I really, what this show has done for me, and I've said this before, has given me that empathetic lens that I put on and see through, to just try to be a little bit more compassionate about the whole process. And hey, every patient is a mom or a dad or, brother or sister.
Yeah, it's so hard. I agree with you actually in that situation, that we did have someone, after my mom had transitioned due to an aneurysm, a friend of mine learned, to watch for the symptoms that my mom had, and her mom ended up having one just this summer, abdominal aortic aneurysm. And so it was, she immediately acted. She got her to the hospital, and she was 78 years old, and they decided to go ahead, and they had to do, because it was at that point where a minimally invasive endovascular approach to treating this aneurysm just was not going to happen. And they opened her up, performed this procedure. And maybe for your 97-year-old, it probably might have been soon enough to do a minimally invasive procedure and put in those covered stents and such. But for this one, it wasn't. And she weathered through this very painful process of the open procedure. She got home, ended up with a blood clot days later, and just was gone. And so it's like, well, you know, do you really want to put someone through that process? And for me, I have literally tortured myself over and over and over again, thinking, God, why did I miss the signs? Why didn't I get my mom to a doctor sooner? Why I have access to you, Dr. Phillips? Why didn't I ask you about it, about the symptoms she was experiencing? And what I keep coming to is the conclusion that my mom still had quality of life in which she wasn't being poked and prodded, right? She wasn't in a hospital. She wasn't back and forth between appointments. We ended up in Tahoe. And if we would have caught it sooner, how much longer would it have given her, really? She probably would have ended up with that blood clot, because what I found out is so many patients at that age do end up with a blood clot that kills them following, a fix of an aneurysm. So, or any procedure at all at that age, there's that high risk. So it's really and I love that you said, what is the quality of life these patients are looking for? And for an aneurysm, my mom died right in my arms. She's like, Kimmy, I don't know what. And she just faded right into my arms. And it was almost, if you can call it just beautiful, it was just peaceful.
Yeah. I mean, you said it fantastic. So stay with us, folks. Coming up after this break, we're going to continue our very candid conversation. So stay tuned.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Thanks, everybody, for joining us. During the break there, we had a little conversation with Douglas, who's a longtime listener. And Douglas, I don't know, man, I'd like for you to share what you had said to me during break with the rest of our listeners, if you don't mind.
I know. I love that, because he was complimenting you and what you learned through participating in this. This was great. Douglas, go ahead and share. It was really powerful. So.
I think I was talking to somebody in the group yesterday, and we had discussed, he went to his doctor, and when he left, he said, I don't feel like I got everything answered. I understand he's busy, but I left with that little bit of extra hope that I didn't Google my symptoms and I'm going to be dead in 5 years. And I think for most of us as patients, that's kind of what we want y'all to understand a little more, is that spend that extra 5 minutes with me, because I do know you're busy and you have a lot going on. You really do. And I have to tell you, from when I first met you to what we see now and what we hear and what we see and what I met you in person, there is a difference. I can see more compassion. I don't know if that's the right word, but I can see where you're gaining more wisdom or understanding about what we feel like when we want to leave the doctor, with that extra sense of hope, and that you spend that extra 5 minutes with us. Because I remember going in scared. It was like, holy cow, I'm gonna be dead in 5 years. And when I met Kim and this group and what they were able to teach me to say when I went into the doctor and asked those questions, you were talking about that. That is so important. But to actually have that Dr. Walker rolled across the room on his cart, put his hands on my knees and said, you're going to be okay. We're going to be able to fix this. And I drove 4.5 hours home with that extra bit of hope. And I think that's the most thing we want y'all to understand.
Yeah, I'll say, well, I appreciate those thoughtful words. Honestly, what I've kind of learned over the years is you have to be a little bit careful being overconfident, but you also have, I call it humble confidence. I mean, like you have to be humble in what you can do, but you also have to know your limits. And I have been, and I don't want to give people false hope and be like, hey, I'm going to fix you up 100%. But I always tell people, listen, if you're willing to fight for this, I'm going to fight with you, and I will do what I can to the best of my ability. And if I can't get you what you need, then I'll try to find somebody who can, get you help or help you. And the last thing I'll say is that touching the patient, just putting your hand on their shoulder, and I think that means a lot more to them oftentimes than 3 minutes of verbiage. And so just trying to find that link with the patient. And it's just two humans interacting, and it's not necessarily a physician and potentially a power role, and then the patient who is often vulnerable and just kind of raw. And that's what I've found, and I think that helps.
Can I share one thing? You had mentioned to us before that you were in surgery one time and you realized, I have this person's life in my hands. And that's got to be a scary thought on your side also, doesn't it?
Well, I mean, that's a really good point. There was an entire, monologue that you had that was so powerful that is on our youtube.com/The Way to My Heart channel. If anyone wants to go back, it'll bring you to tears. This aha moment that Dr. Phillips had when he was in this procedure. Thank you, Douglas, for bringing that up, and see how powerful it is. He even remembered it. Bring us back to that moment, just because I think it's worth repeating.
Well, I mean, it was just kind of this, it was when I remember kind of like interacting with the patient's blood, because we put a tube in the artery and, there's blood, right? And when you start to, I'll backtrack a second. You have to be, at least in my mind, a little bit careful about getting paralyzed by the thought of what you're doing, in the sense that, yes, you have an objective, there's a blockage or whatever, and you're trying to get that opened or help the patient, but you can't get too caught up in this is someone's mom, this is someone's brother, and then your head starts to, you're swimming a little bit, and it's renting space when you don't have space to be rented in your head. Having said that, it just came about me, and I wasn't trying to be too profound or anything, but it just dawned on me, like, this blood is what keeps this person alive. It is so powerful, and I felt like this is kind of a gift that I'm able to, the patient is allowing me access to this, and hopefully I can help them. And it was a little bit emotional for me, but again, you just kind of, you move on, and you think about these things, and I can say it, and that's that, I guess.
And it's interesting with some of the most advanced doctors that are performing, especially these endovascular procedures. I hear this over and over again from every single one of you in different words, but the same intention and the same meaning, in that, and one of the doctors actually said it so directly that he actually goes in and reverse engineers the wellness that the person desires when he's looking at these blockages. So he goes in and he sees this person in their wellness and reverse engineers it to actually create the wellness that the patient desires. And I thought that was really profound, because he says that he doesn't think that there's a blockage he can't cross with that intention and with that feeling, and with that approach. And I know that I see you nodding. So it's the same thing for you as well. And that's where you were talking in the beginning about how attitude is so important. If you can't change what you see, you got to you got to change the attitude around it, which just may create the change that you do want to see, right?
Yeah, and I know we've got maybe less than a minute left, and we can continue this definitely, but you have to, yeah, I mean, we can get across any blockage, frankly, but the question becomes, is that the right thing to do? And then there's the fine line of, am I putting this patient at risk for something? So you have to kind of sometimes pump the brakes on your own confidence and take a step back and, okay, what am I trying to do here? Not do too much. We talk about the enemy of good is better and things of that nature. And so it's a fine line. And that's why I hate to say it. I mean, yes, medicine is a practice, but I mean, there is some there's nuances obviously to what any physician does. And at the end of the day, you have to do what's right for the patient. And that was another thing too. I always try upfront to say, listen, this is what I'm thinking. And, I want shared decision making with you as the patient. And if I think that we're going to get into a situation where your overall life is not, in jeopardy, me trying to fix something, we're not going to do it. And I think once patients understand that expectation, things go a lot smoother.
I agree. And coming up right here on the Heart of Innovation, we're going to have more of this kind of discussion about the treatment of patients with peripheral artery disease, like circulation issues that are indicative of the leg pain while walking, leg cramps while walking. You don't want to miss the rest of this conversation, so stay with us right here on KDOW. Don't go away.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody, and thank you for joining us. We're having, I think, what is a candid yet fun and enlightening conversation about all things. And I did, so you had mentioned during break, Kim, the story between Alan and one of the physicians that was at the Save My Piggies. But before, and I'll let you tell that story, but before you do that, I just have to say to Douglas, that dude is a fly dresser. Like, he rolls in I think these orange pants and kind of pretty loud sneakers or whatever they were, and I thought that was pretty sweet, man. So kudos to Douglas. He's got a lot of.
I'm always wearing pink, right? I wear pink all the time. So the one day that I'm not wearing pink, he actually he rose. He represented the pink power that normally is me, and I was so proud. I was like, "Thank you, someone wore the power of pink."
What were those pants? Pink, hot pink, or the shoes? The shirt was pink. That's right. The shirt was pink.
The shirt was pink.
I mean, as the parlance of our times, the kids would say Douglas had some pretty good drip on. I think. Did I say that right?
I don't think I've ever even. But you having kids, you probably know more than me.
I'm gonna make sure they listen to this, and then I'm sure they'll critique me that was inappropriate.
I love it. The most amazing part of the conference was really seeing everyone in person and the tears that were shed. And we so many of the folks that were there, we've gone through so much. We've supported them, and we've been very blessed to have people who trust the Global P.A.D. Association and trust us as P.A.D. navigators to be with them throughout their entire journey. And they put so much faith in us, and we really do everything in our power to make sure that we live up to every single ounce of faith and trust that they have in us. And one of those patients is a gentleman by the name of Alan, who joins us a lot in our live studio audience. And the Global P.A.D. Association, John, as you know, is mainly about helping people who have leg issues, but 3 in 5 people who suffer a heart attack have these leg issues known as peripheral artery disease. And we always say, if your leg health could indicate your risk for a heart attack, stroke, and or amputation. And so for every patient that comes to us with PAD, we always make sure that they get their heart checked. And for Alan had already had either a triple or quadruple bypass at one point a long time ago. And so he was starting to have issues again because he did end up losing a part of one of his legs. So he wasn't as active all the time. When you're not as active, it allows the plaque to build up, I think, a little bit more and faster. And so he ended up with more plaque. Some of his bypass grafts were going down. He had other general arteries that were not working, that were getting blockages. And so he goes to his cardiologist. The interventional cardiologist pumps in the contrast fluid in a heart cath or angiogram, right, where they go in to try and open those arteries. The only thing he did was pumped in the contrast fluid, and not even well. The imaging, according to the new cardiologist, he said it was terrible. And he had to redo it before he even went in himself. And the doctor says to Alan, well, nothing we can do, didn't even try. And told him that basically to go home and die. Go take these meds, and if they don't work, well, just, say your last goodbyes to all your family. And so Alan went home, losing hope, took the meds, was taking nitro almost on a daily basis, even multiple times, a couple of days. And he finally called me. Actually, our friend Douglas here convinced him to call me. And I said, okay. I got on the phone with Dr. Parag Doshi. He is a pioneer of crossing chronic total occlusions, meaning 100% blockages or CTOs. He's written tons of papers on it. So I gave him a call. He was right in the area, and he was in when he answered the phone. He was at the Arctic Circle with his wife. I couldn't even believe the call that he had reception there. And I said, what are you doing answering the phone at the Arctic Circle? Because I was like, well, where are you at? It sounds like you're overseas. And he said, well, and this was so meaningful to me. He said, well, because you're calling and you don't cry wolf. You call when someone needs help, and that's what I'm here for. And literally in that moment, he said, check your text. I have my partner that's there. He'll get him in today. And Alan, I hung up the phone. Alan drove 2 hours to this doctor. And to go full circle in our conversation, he and I have worked together on preparing for these appointments. In 2 hours, it's hard to get all your records to this doctor because we had his story lined up and ready to go with all of the pertinent information that he needed to talk about, including the timeline, all of his previous procedures. The doctor knew exactly what was going on, was able to get him in immediately the next day for a CT angiogram to get a better visualization of his coronary arteries. And he got him in the next week with a heart cath, and immediately, literally within 45 minutes, he was in and out. They opened his left main, chronic total occlusion, and he's doing great. He's been on the treadmill. He's even lifting weights. So it was just, and he shared this story to say to patients, you've got to get a second opinion, and you've got to have your story in order to best advocate for yourself to get timely, expedited, effective care.
Yeah, no, that's again, our system is broken a lot of times. The gentleman, because I think you before we went on, you wanted to talk about the case that I did at the conference, AMP or AMP, and the gentleman that we found for that case, he was told by 2 other physicians that he needed a major amputation, and he said, no, I'm just going to come see somebody else, and he saw me. But I think it was June when he had there was a referral that was put in to see me, and I saw him on the 13th of August, because then we ended up doing our live case on the 14th. But I mean, so the system is kind of broken in the sense that it took him that long to get me. Had I known that he needed to come see me, I would have made space in my calendar, and we can manipulate the system, but most patients don't know that, and it can't work for everybody. But again, it's having resources such as yourself and the Global P.A.D. Association where patients can find an outlet and find somebody that can maybe get them in touch with a physician that might be able to help them.
Yeah, no, exactly. Well, coming up right here on the Heart of Innovation, we're going to have our final thoughts. I love these candid conversations. Really, really fun. I also want to make sure we mention in just a few moments on the flip end of this commercial break, a testing event in Marin County that's happening, free P.A.D. testing. You don't want to miss the time and location, so stay with us right here on KDOW, Heart of Innovation. Don't go away.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Time flies when you're having fun, and we're going to have to wrap up another show here. We've got about, 4 minutes left. So, Kim, how are we going to finish this one?
Well, this week it's interesting because I help patients around the world through the Global P.A.D. Association, and we're now turning 5 years old on September 4th. September 4th is my birthday, and it's coincidentally the inception of the Way to My Heart, which is now the Global P.A.D. Association. And it took 5 years, but finally I'm actually talking to some doctors in our own backyard here in Marin County about advances in medicine and limb salvage. And I found an all-female team in Marin County of all vascular surgeons, and they're holding a P.A.D. testing and also aortic aneurysm testing event. And you know that's near and dear to my heart with my mom. And it is Thursday, August 28th, and it's free. And it is the non-invasive screening. It's a 5-minute exam. Appointments are available from 9 a.m. to 1 p.m. And you can reserve your spot by going to mymarinhealth.org/PAD. So that's mymarinhealth.org/PAD. So really excited to participate. We're going to be giving them some educational brochures about PAD. We're going to give them our How to Walk brochures, because walking, as you know, is the most effective medicine for PAD. So much patients can do to improve their prognosis. And we're going to be giving them some step counter watches, which were donated by the Society for Vascular Surgery Foundation. So we're really excited about it. I think these testing events are incredibly important in helping to save life and limb.
Yeah, they are. I mean, it's like we talk about knowing your numbers from a cardiovascular standpoint, your cholesterol, blood pressure, blood sugar. I talk about knowing your testosterone and your PSA with game day. So this is the next logical progression. Speaking of logical progressions, I'm thinking, gosh, how do we take Save My Piggies on the road and go to different cities? That'd be pretty sweet, huh?
So if anyone wants to actually sponsor that,
yes.
I know that was a great
Shameless
segue.
plug.
I know. Well, we were talking. It was such a powerful conference, the patient conference that we do. We've done 3 over in Chicago now. I've done 1 in San Antonio. We've done a smaller version in Ohio, which you were away this weekend, but next time you got to be in town. But I think that patients love these educational events. And I had even thought, well, there's the New Cardiovascular Horizons conference that travels around the U.S. and they hold smaller events to educate the physicians. Why not partner up with an organization, a powerful organization such as theirs, to say, you do the physicians, and at that same weekend, let's get all the physician speakers to also conversely go over to have a dinner seminar with patients and educate them as well. So those kinds of partnerships we're definitely open to that. And I think they could be really fun and very powerful.
Sure. And again, you're making a lot of, I think, good inroads with folks that can help us, because it takes more than just you and I kind of gabbing on the air. I mean, we've got to get support, and we're getting there. So that's a bit of a teaser maybe for next week, right?
I know. We want to announce, we're really excited this week. Be looking for announcements about who has generously come on to keep this show alive. It was a little sketchy there for a few minutes. Me up all night. My YouTube producer, Josh, was up all night with me on that one, stressing about how do we keep this show on the radio, not just online, but I think it's really powerful to be on the radio in the San Francisco Bay Area, because we do get so many patients that end up learning about PAD and cardiovascular health through our broadcast, and they call our Lifesaver hotline at 415-320-7138, 415-320-7138, in order to ask questions, additional questions about, PAD and CAD. And we help them to get the information they need, as well as facilitate getting them to timely care.
Is that man 24/7? Like, I could call it right now. Who's going to answer?
It'll be one of our PAD navigators. I'm looking at one of them in our live studio audience right now, who has answered several calls during this. Sometimes during the middle of the night, we don't get as many calls. So, but I do have, I get dinged. And so do my PAD navigators get dinged if someone does leave a message, just to make sure if we do need to get to someone immediately, we can.
Because
our goal
obviously the disclaimer is if they're having something life-threatening, they've got to call 911, right?
You always need to call 911, but we have had calls in the middle of the night, a few of them, from patients that were already in the emergency room, patients who were on deck for amputation Monday morning. And we were able to say, hey, you know what? If you're on deck for amputation Monday, why not get to a doctor on Monday who will actually attempt to open that up? So if it's safe for you to leave and get a second opinion, you know, we've had those moments where we've been able to save some piggies.
Indeed. I was wondering when you were going to, all right, nice mic drop.
I love it. I love it. Well, thank you so much, everyone, for joining us right here on the Heart of Innovation. We're ending one season, and next week we are beginning another season with a brand new sponsor, generous support from the industry. We can't wait to tell you all about it. I'm going down to visit the company this week. So stay tuned to see who this company is and how they are supporting our efforts to save life and limb. Have a great weekend, everyone.